In our practices, we need some telltale signs that the patient is wearing the headgear as prescribed. Asking them is only moderately reliable. The first sign we use is to check the mobility of the molar teeth. They should be approximately Class 1 plus mobility by periodontal standards. Non-mobile teeth do not have headgear force applied to them. The face bow should insert easily into the headgear tubes. When first delivering a face bow, some difficulty will be encountered inserting the inner bow. Tooth movement and tube wear should allow for easier insertion of the inner bow. And finally, the neck strap should be worn and dirty. Clean neck straps are not a pleasant sight to practitioners that want results. As we mentioned at the beginning of this videotape, we hesitate to recommend on a routine basis the use of headgear to distalize teeth. The main thrust of headgear use in the POS system is to restrain growth of the maxilla for Class 2 correction. We also mentioned the control of vertical growth with the use of high-pull headgear with or without anterior spurs. Let's now discuss growth enhancement with extraoral force. In Class 3 cases where the problem is maxillary insufficiency instead of mandibular prognathism, reverse pull headgear or the face mask may be used to enhance maxillary anterior growth. Dr. McNamara has also suggested the use of rapid palatal expansion before application of the face mask for improved results. Headgear may also be used to enhance anchorage of posterior segments to allow for more retraction of anterior segments. Those cases with severe Class 2 with maxillary protrusion must have the upper molar stabilized to prevent mesial drift of an already mesially positioned first molar. Class 3 elastics may also be used while headgear stabilizes the upper molar to effect retraction of lower incisors. In the POS system, anchorage enhancement is the only viable use of headgear in adult treatment. Anchorage enhancement may be accomplished with 10-hour wear per day. The inner bow of the face bow may also be used to expand the upper arch by widening the inner bow to be larger than the molar width. Squeeze the bow to insert into the headgear tubes, and the net will be expansion. Toe in the ends of the inner bow, and the upper molars may also be derotated to gain arch length. We feel it appropriate to begin treatment at an early age, at possibly 8 to 10 years of age, the treatment of severe Class 2 malocclusions. Those cases with an excess of 4 millimeters of Class 2 are candidates for extraoral restraint of maxillary growth. Be alert, however, not to accept those cases with terminal plane first molars and Class 1 cuspids, since these are most likely Class 1 cases to start. At this age, cooperation is better, although the growth is less than the pubital growth spurt. Left untreated and severe Class 2 cases many times must be extracted or for successful treatment. The method in Phase 1 is to merely place upper first molar bands and apply 12 ounces per side of extraoral force for 10 to 14 hours per day. On this patient, back for the monthly adjustment visit, needed the anterior face bow repositioned. We will use polybond cement in very tightly fit bands for the retention needed in this type of treatment. Each month we will check for the Class 2 correction. Also checking for the upper molar band being loose and the face bow being easily inserted. This patient still has some Class 2 with some anterior open bite. Using light wire or bird beak pliers, we will adjust the distal end of the inner bow to position the face bow more in line with lip closure. We will now hook up the cervical neck strap and check the forces on the face bow. One last type of extraoral force used occasionally in the POS system is the J-hook. J-hooks are used to the anterior segment and cause intrusion and retraction of maxillary incisors or cuspids. The high pull head cap is used for J-hook application. This brand of J-hook headgear may be used with modification to preform J-hooks. A solder machine or flame is necessary, however, to provide an attachment for the elastic. We use 6 ounces of elastic force for J-hook application. The elastic is attached between the side of the J-hook pad and the J-hook wire.